Okay, so I am Emmeline, and today I'm going to talk about amplified MRI. Okay, so just an outline of the talk that I'm about to do. First, I'm going to go through some background and important things to know before I um, kind of continue on into the MRI acquisition process. And then a lot of the talk will be focused on the data processing techniques necessary for this technology. And then I'm going to compare 2D versus 3D amplified MRI and talk about different phantom studies and patient data. And then I'm going to finish up the talk by talking about some applications, my conclusions, and then where this technology is headed in the future. So, what is amplification in the sense of MRI? So, amplification, in the sense, relates to the relationship between the brain and the heart. And so, first, we're going to, as kind of an important background, we're going to talk about cardiac gated MRI. So, when you're taking an MRI of the heart, an important thing to understand is that the heart is going to move throughout the MRI. So, you can use this process to get um, a good MRI of the heart. So as the heart beats, it goes through these different anatomical states where the blood is in different positions and the heart muscle is in different positions. So these are, like I said, these are the anatomical states. And you can correlate these with a measurable electric signal. So you can, this is a ECG, which you can measure from a patient, and then from that data, you can kind of understand the anatomical position of the heart at that time. And so you can use this gating on an ECG where you kind of trigger the data collection at the beginning of a cardiac cycle. And then you can kind of repeat this until all of the data required is for the MRI has been acquired for like a cardiac phase. So then afterwards, you kind of rebin all of the images that were at a certain cardiac phase. So like here, you take all of your images that were, at this like light red area with like the P wave, and you kind of bin those together, and then all your images from like this area and like etc. You can continue this on until you have these bins of the MRI data from like different points in the cardiac cycle. And so this is known as retrospective gating when that's based off of the cardiac phase. And so this is very helpful because you can produce an MRI of the heart, and that looks something like this. So you have this very um, good MRI that isn't, you can see all of the different anatomical positions over time. And this is relevant because the heart, here's another MRI of the heart, and the heart is this mechanical driver. So, and as this very anatomical picture suggests, the heart is connected to the brain. And so this means as the heart contracts and relaxes during the cardiac cycle, there will be variations in like the blood pressure throughout the arteries, and this is kind of transmitted throughout the body. And this will lead to subtle deformations of the brain. And so if you look at the brain motion during the cardiac cycle, you can kind of see this biomechanical response of the brain. So we'll see like tissue pulsation, and this could have important applications. And the amplified part of amplified MRI is looking at these brain movements from cardiac motion and amplifying them enough so a human can see them visually. So here is an example. So on the image on the left is like a normal MRI scan, and then the image on the right is a amplified MRI. So you can see that there's some like brain motion going on, and so the motivation for this is that it's a way to visualize this brain motion that occurs, and a benefit like MR like no other MRIs, it's like non-invasive, and from this, you can visualize like tissue deformations, which could lead to better understandings of like physiological variations within patients. And the first paper about this was like published in 2016. So this is kind of a new idea. Um, okay, so for the MRI acquisition part of it, one thing to note is, so this up here is our ECG that we looked at before, and these tall spikes are R waves. And so an RR interval is like the distance between these two R waves of the heart electric signal. And so you can have these different colors like correspond to the different cardiac phases. And so within each RR interval and like within each cardiac phase, you can kind of have you can have your MRI. And um, so within each RR interval, you have your different readout lines, which is over on the right. And the N seg stands for like, or it means like the views per segment, or like the number of phase encoding steps per segment. And so this imaging is like repeated throughout multiple cardiac cycles until you get like all of K space filled for each part of the cardiac phase. And so the temporal resolution of this is TR, which is the repetition time of the MRI sequence times um, the the views per segment, and the acquisition time is like the number of phase encoding steps over the views per segment. And so increasing the views per segment will decrease the acquisition time, but it will increase, or but it will lower the temporal resolution because there will be like an increased time between cardiac phases. Okay, so now I'm gonna go through, before we go into a large part, which is gonna be data processing, I'm gonna go through a few background concepts that are gonna be important to understand later. So the first one of those is fluid flow perspectives. And you may have heard this if you took like a fluid class, but there's like Eulerian perspective and Lagrangian perspective. And I really like this comic as a way to illustrate it. So the Eulerian perspective is you are you stay in a fixed volume element, and the fluid kind of like moves through that volume element, which is like standing on a bridge and watching the water go past. And then the Lagrangian perspective kind of follows the motion of the fluid element, which is similar to being on a boat and moving with the trajectory of a certain fluid element. So for this amplified MRI, it's going to be from the Eulerian perspective. So we're going to be assuming that like the fluid, we're going to stay at a specific voxel position, and then we're going to kind of look at how like fluid could move, or fluid or tissue could move in that fixed voxel position. So another important concept is the Laplacian pyramid, and just in general kind of like image decomposition. So this method works by recursive reduction and low pass filtering. So the image gets like broken down into these different images at differing scale, so, and differing like resolution. So you'll get like higher up on the pyramid, the images will have less resolution and like there'll be less pixels. And so this allows for kind of like easier comparison between image because you can start with like a lower resolution, less pixel image comparison, and then higher up on the pyramid, and then you can kind of go down, and that will simplify the comparison. Another important concept is a bandpass filter, which it only allows for certain frequencies defined within the bandpass to go through the filter. So it will like isolate frequencies within a specific range. So if the frequency is within the pass band, then it will move on. But if it's not and it's within the stop band, then it will be attenuated. Okay, and the final background thing before we can get into processing is 2D Fourier analysis. So I know that this was a little bit important in, or not a little bit important. I know that this was talked about in the aMRI before, but I just wanted to mention this again. So normal Fourier analysis is you can decompose a function into like a combination of different like sine and or cosine waves at different phases and amplitudes. But 2D Fourier projection, you have these different planar waves that you have like a phase, frequency, amplitude, and orientation. And so K-space is like a collection of these different spatial frequencies. Okay, so now I'm going to talk about the motion magnification part of this, which is really the is a very, very important part. So this method is called the Eulerian video magnification method, or EVM, and it was developed in 2012, like separate from aMRI. So this is a method that had been around previously, and then the people who developed amplified aMRI just like adapted this for MRI scans. And it had been used before to kind of amplify changes in a video over time. So it was similar to application to the aMRI. And the assumptions are that the data is spatially smooth and that the tissue undergoes small motions, and both of those are the case for brain MRI. So first, the images from each cardiac phase, the brain images from each cardiac phase are spatially decomposed. So you use cardiac gating to obtain your MRI, so you know what part of the cardiac cycle the different images are from, and then you spatially decompose those using your Laplacian pyramid. And they use 9 spatial frequency components. And although this wasn't like explicitly stated in the paper, I think that these spatial frequencies are coming from like the Fourier analysis of the MRI, which was described on the previous slide. So the next step is the temporal bandpass filter. And so each of those previous components are going to be bandpassed in the temporal direction. And the bandpass is pretty narrow, so it only allows a heart rate induced motion to go through. So it's based off of like what a reasonable heart rate would be. And so you can kind of like extract motion that's specifically from the heart. So then that extracted motion is amplified by a factor, which is shown here as like the alpha value, and then that's added back into the original image. And and then those images can be summed to reconstruct the output images. And just to summarize, the output of this is going to be an MRI similar to what was before, but just with the motions from the heartbeat are amplified by that amplification factor. So this was the initial kind of proposal of amplified MRI. It's using this cardiac gated method using MECG, and then it has the EVM method to extract motion. And this was very exciting because, you can see this pulsatile motion in the brain and in other areas, like you can also see the cerebrospinal fluid motion here. And so um, it was proposed that, you could look at like vasculature throughout the brain. And another exciting thing was that what they found was the movement kind of agreed with other literature about how they thought structures would move. And um, so it's able to, um, so one thing is that it improved the visualization from phase-based contrast MRI, which was kind of a tool that was being used before to look at brain blood flow. Sorry, brain blood flow. So, and it kind of has like a higher temporal resolution. So it's definitely like an improvement from what came before it. And this initial proposal was very exciting and novel. But soon they found that a better motion magnification method could improve these results even more. So this new method is from 2018. They came up with this phase-based amplification algorithm. And this was used to increase the temporal signal to noise ratio. And so the first step is to decompose the images into scale and orientation components using a linear complex valued steerable pyramid. So basically what this means is that you're just decomposing the image into those different planar waves and kind of like separating those out from each other. And then those are independently filtered, like at each orientation and scale. And you again use like a temporal bandpass filter to isolate those frequencies that correspond to motion. Yeah. Um, yeah, so you can process those. And then an optional step is you can do some spatial filtering, which will increase like the signal to noise ratio. And they use like amplitude weighted Gaussian spatial smoothing. And the benefit of doing this step is that it will allow for a larger amplification factor, so it will show more movement in the final image. And then the final step is that you can amplify the signal and then add that back to the original signal, and then the video will be reconstructed. So to kind of sum this up, the input is deconstructed into these phases, which are filtered to isolate the frequencies relevant to motion, and those frequencies are amplified and then added back in. And so unlike the EVM-based amplified MRI, this phase-based MRI, the EVM-based MRI amplifies temporal brightness changes, so noise will be amplified linearly, but one of the big benefits of using this phase-based algorithm is that it modifies the phases, so it'll amplify the phases, so it doesn't increase the magnitude of spatial noise. So then to kind of confirm that their algorithm worked, they did a digital phantom simulation. So they had these two phantoms, a disk phantom, which is supposed to mimic the cerebellum, and a bar phantom, which is trying to mimic like the cerebrospinal fluid. And they added like motion and noise to these phantoms. Then they converted that into DICOM images and they amplified it using their phase-based algorithm. And then after they did that, the phantom position was calculated. And the results were exciting because their phase-based algorithm worked as they expected. And The results suggested that future quantification of brain tissue motion might be feasible because they found that there was a linear dependence of amplified displacement on the true displacement of the phantom. So it's like a linear amplification, which could lead to accurate displacement measurements in when doing this on patient data. And then additionally, they found some like that like the phantom size and the phantom intensity, like they kind of flickered it a little bit to mimic in and out of plane motions. And they found that the amplification didn't really depend on any of those things. So that's also a good thing. So here is a video showing EVM-based versus phase-based MRI, or amplified MRI, sorry. So this left one is like the original MRI, and then the middle one is that original algorithm, which is using that, uh, which was doing like more things with the multiplying amplitudes, and then this phase-based is using like the phases of the frequencies. So you can
see that the phase-based MRI has less artifacts. So like if you look at this EVM one, there's kind of a lot of like shading in different areas, and like cerebral fluid kind of has some strange effect going on. And the phase-based MRI doesn't really have the same effects. So they found that it was less sensitive to artifacts, and also it had like diminished blooming and pulsation artifacts throughout the brain. So overall, it's just superior image using this phase-based system. So from an amplified MRI, you can create a freeform deformation image. So it's basically showing the normalized temporal average displacement. So you can measure how far each part of the brain is moving, and then quantify that displacement and then make a map of the average throughout the brain. And so this image on the left is the patient has a Chiari-1 malformation, and then the image on the right is a normal 4-year-old scan. And the Chiari-1 malformation is from a 3-year-old patient. And so Chiari malformation is where the brain tissue will kind of go into the spinal canal. So it can occur if like the skull is misshapen or maybe smaller than needed for the brain, and it will kind of like press the brain downwards. And as you can see here, that from this amplified data, you can see the differences between a healthy brain and this like malformation. And it highlights these two spots specifically where there's a lot of motion in the malformation brain. And one thing that wasn't talked about in the paper, but I found interesting, was that when I was researching the Chiari-1 malformation, there were a few places who said that the signs and symptoms may not occur until late childhood or adulthood. And I don't know the specifics about this pediatric patient's case, but as a 3-year-old, I just wonder if this allowed for maybe an earlier detection than would have otherwise. So that's maybe an exciting possibility, because I think that this is something that can be treated by like removing some material. And this video here is just the actual amplified MRI of the two different cases. So you can see like the top is the reference MRI, and then the bottom is the amplified one. And so you can see especially where they highlighted it in the previous slide. You can see a lot of deformation here and then down by the brainstem as well. And so overall, phase-based MRI, it showed an improvement from the EVM method, partially because of the better temporal signal to noise. And the phantom data suggests that there's a possibility for movement quantification. And then again, as shown in the Chiari malformation 1 case, it can kind of show abnormal biomechanics in the brain and help diagnose and kind of like understand that. Okay, so I'm not going to go into this in depth, but this is like this is another paper and application where they used amplified magnetic MRI. And so they used it with diffusion tensor imaging, which is a technique that kind of exposes changes in white matter architecture. And the paper was looking into subconcussive collisions, which is like an impact to the head that could alter brain integrity, but like doesn't have any clinical symptoms. Like you probably wouldn't be diagnosed to have a concussion. And they were kind of trying to look at like long-term exposure to impacts, if that could be like associated with any neurocognitive impairments. And so they used amplified MRI and they kind of used it to determine if there were region-specific differences in like tissue mechanisms. And they thought this would help them understand like fiber susceptibility across like different areas. So this image is showing like the corpus callosum, which like, connects the two halves of the brain. And you can kind of see this is like a strain map of, you know, how the tissue is changing. And you can kind of see that different areas have different strains. And so they proposed amplified MRI as a possible way of modeling head impacts and to study like the consequences and effects of like microstructural injury on brain health. Okay, so now we're going to transition from 2D to 3D amplified MRI, because 2D amplified MRI had a lot of promise, and they thought it was you know, had a lot of applications, but they wanted to improve it. And so the 2D amplified MRI had only amplified motion in the in-plane direction, which led to some motion artifacts. But in 2021, so very recently, they proposed 3D amplified MRI. So this is a new algorithm that amplifies motion in 3 directions, and it improves the image quality and motion visualization because, you know, it's able to look in all these 3 directions. So the 3D algorithm is very similar to the phase-based 2D motion algorithm. The one, again, it's assuming that the motion is within the voxel, but the difference, the change that allowed it to be 3D is they decompose the images by a 3D complex steerable pyramid into those different scales and orientations. So again, you have your input images, and then it goes through a filter, and then you have your pyramid decomposition. And these different colors represent like the frequency response, and so it's like showing the different scales and orientations. And then the phases of this information is separated out from the amplitude. And the phases are temporarily bandpassed again to extract that motion from the images, and then they can be filtered spatially to increase the signal to noise ratio, as in the same as the 2D. case, and then they're multiplied by the amplification factor and added back to the original amplitude and reconstructed. So similarly to before, they did a digital phantom simulation, and this phantom was trying to mimic the brain motion, so it was like compressed, which led to motion in and out of the plane. And they found that it was relatively linear amplification both in and out of the plane based on different amplification factors. So they propose that increasing the amplification factor within the considered range could linearly amplify the actual motion without introducing noise and artifacts. So the results of using a 3D amplified MRI versus 2D is that there are less motion artifacts with 3D. So like I said before, it captures that out of plane motion, and it also there's reduced like partial volume artifacts because you can kind of have a better understanding of like what slice everything is in. And so in this image, there's like the reference MRI picture and then your unamplified 3D data, volumetric 2D and volumetric 3D. And so if you're comparing the 2D versus the 3D, you can kind of see that the 2D has these red arrows are indicating artifacts. So you can see that 2D kind of has this like strange shading that isn't present in the 3D. So the 3D is overall just a better characterization. Okay, and so this is just a video of the same artifacts that I talked about before. So 3D is on the bottom and 2D is on the top. And so if you look at the 2D image, you can again kind of see these like shadows pulsating that are not really real and more just artifacts. And again, this is partly because the 3D can capture both that in-plane and out-of-plane motion. So to demonstrate the robustness of this new 3D algorithm, they applied it to other contrasts. So this MRI, there's a type of MRI called flash, and then this BSSFP, balanced steady state free precession, is like what they had been using before, like using cardiac gating and everything. And so they applied their amplification algorithm to flash data, and they found that, well, for one thing, the brain motion between the two types of MRI was like very similar. And another thing was that when they took the maximum intensity projection of the flash data, you can see the pulsation of blood vessels in the brain. So this amplified picture, you can you can kind of see like this vasculature, and this could be used to like look at actual blood vessels within the brain as they move throughout a cardiac cycle. And additionally, when you do 3D, when you do 3D MRI, you can also do a 4D animation. So from their 3D MRI data, they kind of created this optical flow map of how the different like how the blood is like moving over time, and they kind of made it into this 4D image. And then over here is kind of a I don't know, a different way of visualizing the movement, and then they show it in multiple different directions. So this animation just allows you to show like the complete brain tissue, and then also like the cerebrospinal spinal fluid motion. So another thing that they looked at was after calculating the like the amplification throughout the brain, they made 3D displacement fields of the brain's motion. And this is from this like analysis technique is a tech that they used is something that is used in like structural dynamics. So it's been used before, but they just like applied it to the situation. And it creates kind of this field that shows like the response of different brain structures, and you can compare different regions of interest and kind of observe the displacements and directions of those displacements. So a case study of a patient, this was done in 2022, where this patient has a hematoma. So a hematoma is like clotted blood within the tissue. And you can see it here. This is just a still MRI of the patient, but you can see it here. And they wanted to investigate how amplified MRI would do at like looking at abnormal motions. And so I can go to the next. But so this is the MRI of that patient. And so you can see just like generally throughout the brain, you can see that pulsatile motion of the brain tissue. But there does seem to be abnormal motion within the hematoma. So it's similar pulsation, but it just has like a larger amplitude than other areas of the brain. So this was like a good investigative tool to kind of see that. But one thing that they mentioned was you can see that the skull appears to be moving, and they were unsure the if the skull was actually moving due to the movement of the brain, or if this was an artifact that they have to look more into. So the applications of amplified MRI are numerous. It could be used for looking at different brain health things. So for like traumatic brain injury, the like pulsation of the brain could be very relevant to that patient. And it also could visualize intracranial compliance, which it means like the change in volume as related to like the change in pressure, which could also be, it would be important for like brain injuries, and then also for things such as hydrocephalus, which is like when your cerebrospinal fluid accumulates in your brain. And then it could also help with the diagnosis of disorders, because, it could investigate dysfunction and look at the biomechanics, especially near the brainstem, which would be very helpful for that Chiari malformation 1 that we saw before. And this image is from a brain neoplasm, which is like a brain tumor. And so this could possibly be used as a tool to possibly help identify and characterize diseases such as like Alzheimer's or tumors or multiple sclerosis, or other disorders as well, other brain disorders. So for amplified MRI, 3D as an overview, it visualizes subtle brain motion. And so it's able to use processing to kind of reveal those biomechanical aspects of the brain that would be hard to see in a normal MRI. And so due to this fact and that it's non-invasive, it could have many clinical applications in medical imaging. And as well, there is some future future work that of where this technology could be headed. So movement is an essential part of living matter, and movement could be representative of a lot of physiological processes and possibly organ functions. But how movement moves through tissues is poorly understood due to how hard it is to image movement inside of like biological living things. And so, due to the safety and abilities of this technology, it could be used on structures outside of the brain, such as like the liver or blood vessels or lungs. And additionally, showing that the 3D amplified MRI worked for Flash to amplify that blood vessel motion could suggest that it would maybe be helpful for assessing like aneurysms. And the main assumption of this algorithm is that the motions are like within the voxel and the data is smooth. But within those assumptions, like those assumptions are not, those assumptions could be used like on other types of 3D imaging modalities. So the paper proposed that it could be applied to things like CT or ultrasound, which that is probably a long way away, but I did think that it was interesting that they were looking towards the future for that. So I think this has a lot of applications and will allow us to learn more about how movement works inside of the body, which could lead to even more unseen applications. And those are my references. So thank you for listening to my talk.